everyone. Good evening. Dr. Stacy Holweger here. I am so excited to share with you another fantastic doctor tonight that is going to be sharing information with you about LifeWave's technology and how she has used this and utilized this in her practice, and also, of course, be able to answer a lot of your frequently asked questions. So tonight, December the 17th, believe it or not, is going to be our last Tuesday night of the Zoom because next week is Christmas Eve and the following is New Year's Eve. So I have asked my two beautiful, lovely, always existing here co-hosts, Leah Stastny and Laura Balzer, both senior presidential directors with me in LifeWave, to join me on this Zoom. Dr. Michelle is in their organization as well. And so we're going to do a little round robin and we're going to share information. Dr. Michelle is going to fill your cup with all the things LifeWave. And then, of course, we're going to do a little Q&A for you guys. So if you have questions, of course, as always, start dropping them in the chat. Before we get started, though, I'm going to share our disclaimer. The information that we're sharing tonight is for informational purposes only. I am not a medical doctor. Dr. Michelle is not a medical doctor. I'll be sharing her bio here in just a second. So if you have questions in regards to your health and how this technology can help you, please feel free to reach back out to your provider, your medical doctor. As always, we are not intending to prevent, treat, cure, or diagnose anything. And if you're on medications, pregnant or nursing, check with your doctor. Okay. So with that, let me share with you a little bit of information about Dr. Michelle so you kind of get a background. So she is actually has a lot of letters. Let's just say that. Very well versed in all things holistic. And I'm going to let her go into all the details. But she is a BSc Canada, I'm guessing here, Gestalt therapist, a naturopathic doctor, a doctor of acupuncture, a doctor of homeopathy in Australia. It says ASU, so I'm going to let you again elaborate on that. Has over 2 decades of experience in natural medicine, psychotherapy, and holistic healing. After retiring in 2018, she began researching stem cell therapies, but found traditional methods costly, risky, and unsustainable. In 2023, Dr. Michelle discovered LifeWave phototherapy technology, which is obviously a safe and effective way to naturally activate your body's own ability to repair and regenerate itself. Inspired by this simplicity and potential, she returned to practice to help others, combining her expertise in psychotherapy, acupuncture, and nutrition. She customizes LifeWave solutions to meet her clients' physical, cognitive, and emotional needs. She views LifeWave as a groundbreaking innovation in modern natural medicine, affordable, sustainable, and also transformative. So, Dr. Michelle, I would love for you to come on here and give us your background. Like, tell us what you were doing prior to 2018 with all the different things that you've incorporated, and then what took you up to this point to say, I think I better come back out here and share with the world again. So, thank you for being
Thank
here
you.
this evening. Thank you.
Thank you for having me. Yeah, I have kind of a very varied background because initially I was a Gestalt therapist and I specialized in group therapy. And I worked with groups in particular that had addictions. So that sort of took me in a different direction. But what I did notice is that lots of people also had physical ailments with their psychotherapy problems. So, but the one thing that I was doing at the time, I was invited to a hospital setting to show this particular professor how to do some group activities with an addictions group, and it was every kind of addiction. It was like just blanket addictions. Didn't matter what you had, we were going to work with it kind of in a similar way, in a general way. And what we discovered, at the time I was studying biofeedback as an extra course at school, and I invited them to come down to see what biofeedback was all about. And what we found out was really kind of interesting. A lot of the people had what we call a flat GSR. GSR is a galvanic skin response. And if you have a flat GSR, it means you're not modulating your own pain. So that was across every type of addiction, which was kind of interesting. So we started just not not doing a full-on experiment, but just seeing if different modalities could change that, like to get them having a galvanic skin response again. So we sent them a couple to a chiropractor, and indeed, it rebooted them. And then we did homeopathy, and indeed, it rebooted them. So we were really systematically kind of saying, hey, there's a way to get them, modulating their own pain again. Because I mean, that's probably what they're seeking out in the addiction anyway. So we got transferred back before we could really continue that and get some research money behind it. Well, recently it's been revisited again, and I happened to come across a businessman who's bringing a recovery center here, a private one. And we talked about it, and he's excited to maybe see what we could do with that, and possibly what we could do with that with LifeWave technology. So we're going to do a little bit of experimenting there. So that's that part of my before I became a naturopath. But obviously, once you have that, I mean, you bring that into your session, And I always look at what's going on emotionally, what's happening, and definitely Aeon is the best patch for helping with anxiety, generalized depression, aggravation, things like that, anger management, and so forth. I don't know, has anyone ever noticed that if they're wearing an Aeon patch and you have a drink of wine, you actually don't feel that wine? Has anyone noticed that?
I have
never
not
noticed that?
No.
Okay, I noticed that.
That's interesting.
So that therapeutically could be very interesting for especially addictions, right? So yeah, I noticed that I don't I'm usually one glass of wine and that's it for me, but I was like, I could have 2 glasses of wine. I went, what? So that was one of the first things I noticed when I was starting the patch myself. Anyway, so I'll fast forward a little bit. I decided to retire kind of just before COVID because I'm 62 and my husband is 70. So he's like, do we need to continue this? Should we have an office? And of course, everything that was coming down after that would have made it very difficult to get to an office and do those sorts of things. But I started researching stem cells just from an anti-aging standpoint. And I was just very curious because it was really, coming up a lot in conversations. But I was always like, it just never sat well with me philosophically that it was somebody else's cells. I just didn't trust that, and I just didn't feel that was natural. So I had trouble getting my head around that. But also I had trouble getting my head around why they were having such mixed results. And people would say they'd go to have their knee done and they say it didn't do anything to their knee. And I was like, and then others would say, no, it really helped me. And I was like, why is it so inconsistent, right? But of course, after learning about LifeWave, it made more sense that the healing process it goes to whatever's most the biggest priority. So, if your heart is the problem, it's not going to go heal your knee. You're going to think I'd rather it heal my heart than heal my knee. But so that explained a lot of that sort of problem that I encountered when I was researching it. And then, of course, there's lots of risks associated with doing injections as well. And I actually had a friend who he went to have some done and he had a stroke because they put it in the wrong way. So, there's that, right? So that, again, LifeWave is safer than than going in. And I think it relatively has a pretty short life that the healing takes place as an injectable, whereas like the LifeWave technology is ongoing.
Mm.
You know, so you're getting healing every day to some extent, and to, you know, certain amount of hours for sure.
Mm-hmm.
So that, anyway, like I was just very fortunate. One day I happened to catch Denise Wong on a post, and I went, "What? That's exactly what I've been looking for." And then the more I looked at it and researched it, and then I decided to try it, and I just noticed lots of changes right away. In particular, my hair. Oh my gosh, my hairdresser was like, "How is this even possible? My hair is so thick now. My skin is got more collagen in it, you know, I'm less wrinkly, different things. But I just generally feel better. Not that I felt horrible, but you know, it's part the outside shows what's going on the inside, right?
Yeah.
So I knew I was aging per se. But I remember the day I was like, I really want to find something that's not anti-aging. I want something that's age reversing. And then 2 days later, I found Denise. So, anyways, to say I'm happy about the technology is an understatement. It's amazing, and
Yeah.
lots of people that have tried it with me, and also lots of other testimonials that I've seen. It's just it's a great modality, and as you know, I have lots to choose from, and it resonated with me because I really do love acupuncture and acupressure and acupuncture meridian therapy. And
Mm-hmm.
it's just fantastic that this technology utilizes both that and light therapy. I also did color therapy for a while too.
Mm-hmm.
One of my profs did that as a modality. So I joined him to see how he did it. And, you know, so it's kind of phototherapy too, but it's with colored light.
Right.
So,
And so, how long have you been using LifeWave's technology? And then, what are your personal experiences outside of your hair and the collagen and the skin? You said you were healthy. You know, what are your experiences or your husband's experiences? And then, of course, let's hear about, how are you utilizing this with clients in your
mhm.
practice?
Well, I've been using the patches for about, I guess it'd be 15 months now,
Okay.
and pretty steadily. Like I mean, I sometimes take a few days off because I just think you should do that anyway with anything you're doing, just to give your body a little break and do it. I mean, I did notice big changes in my digestion,
Mm-hmm.
and I felt like I was probably absorbing better, because that definitely is a reflection of your hair and nails and skin, that you're absorbing better. Definitely sleeping better. Scar tissue. I have a C-section scar that popped up and is getting remodeled. It's still being remodeled, but it was a pretty big scar. And memory. It was starting to like I didn't even notice it either. That's the other thing, is you're not even aware that you're healing unless you kind of do an inventory. But my husband was the one who said to me, "Do you know how nice it is to talk to you, and it doesn't take you 20 seconds to spit out what you're trying to say?"
Wow.
I said, "No, I didn't even notice that." He goes, "No, it's so nice that I'm like," and he's very polite and he would never say anything to me, but I say, that thing that, you know what I'm talking about. And he's like, "No, I don't." So I was struggling to find words. They were in my head, but
Uh-huh.
I'm struggling to get them out of my mouth. So there's been a brain shift. Absolutely.
Mm.
My eyesight is better, especially my night vision is better, and my skin is better, because I did have white patches of vitiligo and they are growing back. So,
Mm.
so that's sort of the basic things that happen for me. My husband had little skin cancers, like non-benign ones, but he's had them for about 11 years, and he had some taken off again recently, but they healed this time.
Wow.
And so that was huge because they weren't healing. All those years it was slowly, slowly healing, but they would break open again.
Mm-hmm.
And he was this kid that, from Ontario, and he was in the sun till he fried 50 times every day. He'd be like a red and peeling, and he'd go back out in the sun again. So I wondered when that was going to show up. But yeah, his skin has really done well. And even his doctor said, wow, did that ever heal fast? Because he started doing the Alavida patch too.
Mm-hmm.
And then my daughter's boyfriend, he had some PTSD from a job that he had where it was kind of a traumatic experience. And so he suffered a little bit from depression and anxiety and a little bit of like aggressiveness. And he started I just put him on Aeon, nothing else, because he's like 20. But he noticed it right away. I put it on him, and he said it's like the light went off. He said it's like I saw a bright light inside of me. And I said, well, it's working with your own light. It's working with your internal infrared light. So it's interesting. He said he felt like he saw like headlights when he put it on, and he's just been getting better and better every day. And he's so grateful. He said, this has really helped me. I never would have believed that something like this would do something. But he's very grateful.
That's amazing.
Yeah. Mm.
So you've been using the patches about 15 months. You, your family, immediate family have had some results. Are you in practice currently? Are you currently seeing patients?
I see very few patients. I'm not working the business as much as I'm planning to starting in January, but it's mostly family and friends.
Mm-hmm.
And all of them have really noticed huge, especially cognitive leaps, because most of the people that I talk to about it are my age.
Mm-hmm.
And they're the ones that are very motivated to sleep better, feel better, not have pain, things like that. So yeah, and everybody's continued and enjoyed it. And I mean, I don't know if I'm allowed to say this, but my one sister-in-law had a blood cancer, and her numbers are improving. So
Wow.
I don't know
Wow.
if you're allowed to say that, but
It's out there now. Okay.
yeah. I know we're not supposed to say too much
Yeah.
because
Yeah, of course, we're not making any claims to treat or
yeah.
cure anything. No, of
I'm
course.
just anecdotal.
Yes. Something's changing with her. So
Yes.
for all of our viewers out here that are newer listening in, we've got about 500 people on now, and of course, we always have several thousand that listen in afterwards. Can you tell them how does this technology work? How, if you're going to describe this to your friend or your family member in a way for someone that's never even heard of anything, right? How would you say this works for them?
What I do is I tell them that there's a crystal matrix that's been embedded into the patch, and there's different crystal matrices for each patch. So they each have a different kind of a light vibration,
Mm-hmm.
but it's a phototherapy that when you put it on your skin, or in my case, right now I have it on my dress, and you you can do it through fabric too.
Mm-hmm.
It reflects back to your body your own infrared, amplifies your infrared that your own body has for healing purposes, for our own internal healing purposes, which is mind-blowing actually, because like we're the only thing that has to repair while the engine's still running. It's kind of weird to think that we have to heal while we're doing all these other processes. So, but anyway, so it amplifies the copper peptide in your body, which
Mm-hmm.
helps stimulate cells.
And those cells do what?
And the cells can differentiate into different types of cells for the body to use to do some repair work.
That's fantastic. So
Yeah.
when do you put this patch on?
Personally, I put it on when I get up in the morning,
Mm-hmm.
and I have specific places I like to put it, but it will work anywhere. And if you can't, if people have trouble with glue, you can put it right on over your clothing or over your underwear or whatever. So for instance, right now I'm doing X39, X49, glutathione, and SP6.
Okay.
And so I do them all around my belly button, put them on, wear them for 12 hours, take them off, go to bed.
Okay.
It's that simple. You have to have them off. You wear them for 12 hours and then they're off for 12 hours.
Awesome.
Right.
And that's when the healing starts. And I mean, there's a whole sequence of events that happen because you're building an army of cells. And so, the first couple of days, I think they say your cells are 4,000 cells or younger, right? And then after a few months, you're going to start noticing that your collagen and your hair and skin are changing. And then a few months later after that, it's probably a good idea if you go and see your doctor and get some checkups and see how your labs are doing now. And then going forward after that, it starts doing even deeper work. So I just love it. I love the product. I love how I feel. I feel really good. I mean, I didn't have a lot of pain before, but I just feel better, and I'm definitely sleeping better, which is a huge thing. You really want to sleep good.
So, Dr. Michelle, I don't mean to interrupt. I've got to take you back a little bit because you said something, Dr. Stacy read it in your bio, and I'm sure there's a lot of other people in here that are wondering this as well. I need for you to explain what galvanic work is. What does that mean? What type of work is that?
That was biofeedback.
Okay.
The galvanic skin response. Is that the one you're talking about?
Okay. Mm-hmm.
Yeah.
Yep.
So when you do biofeedback, you're hooked up to some probes, and then you're given sounds or a monitor, and you can control those by calming yourself down or by lifting your spirits up. You can control
Okay.
You have the ability to manipulate calming yourself down or being buoyant.
So we're doing that with this device. So when you correlate that with our regenerative technology here, are you kind of comparing that the patch can come in and do the same type of work with the body as that galvanic experience does? Is there a comparison there? Do you feel like this technology can, I don't want to say take the place, but give people the ability to, like you said, calm their nerves from, the Eon patch, letting X39 go to work and not only be calming, but able to stimulate and mobilize those regenerative cells again. So can you compare that a little bit? Is there a comparison?
Yes, there is. I mean, I'll have to tell you a little bit about addictions and cellular.
Well, don't get too far down that rabbit hole.
Yeah, okay, but cellular communication.
Really
it's cellular communication, and it's almost like it does a Control-Alt-Delete to shake things up, and to get things moving again. Because when things are stagnant, that's when you get sick.
Okay.
So you want vibrations. It's like vibrational medicine. You want things to vibrate. If they're not vibrating, you're not detoxing. And
then we can kind of turn that and use words like frequency.
Yes, it's frequency for sure. And cellular communication. And in the case of addictions, so for instance, let's say in the case of alcoholism, there's a lock and key mechanism for our endorphins, and we make our own pain modulators. Like, people don't know, we make our own heroin inside of our body, our own morphine for painkillers. But when something goes and breaks off the key in these receptor sites, we're not making them anymore. Our bodies stop because the alcohol's replaced it and broken the key off. So there's a certain amount of time frame that it takes to detox out those broken keys for them to start feeling endorphins again and doing endorphins. But we can do that, and we discovered that when we measured them and send them to the chiropractor, that you can kind of do a control-alt-delete is what I call it, where you can
almost
kind of,
releases them on adjustment, I guess basically is really what's happening.
well, yeah, because again, it's like neural, like anything, any modality that is going to get through to whatever the stuckness is. And I don't know if you've ever heard of the whole, it's called the root cause with the movement of iron. Well, if iron gets trapped in an organ, it's gonna not, it's not gonna vibrate as good, right? Because it's stuck. But copper peptide plays a huge role in moving iron around your body.
And we know here we're elevating that GHKCU,
absolutely,
which is really responsible for so many incredible things. And you know, if you don't mind, I am going to encourage everybody on here when they come off to really Google GHKCU, because you will find 13 pages on PubMed about the benefits that it has for our body. So I'm going to ask you one more question, and just take a few minutes here to answer this. You know, you mentioned PTSDs, and you know, when I was growing up, that was an abbreviation that was used for a lot of our veterans and people who had gone off to fight for the freedoms that we all sit in. But today, that abbreviation has been broad-banded over many genres of people, very many age groups. What have you found using the Eon, using X39? What are you seeing in these patients and clients of yours that have experienced? Because we all know this technology covers spiritual, physical, and mental,
absolutely,
embodiments. So
just so you guys know, let me share with you real quick.
Now, what is that?
I have no idea. Leah said she was hearing all these people entering and sounds and dinging. And then
I promise you it's not my end.
and I said, I don't hear them. And now all of a sudden I'm hearing all these weird dinging entry, weird sounds we've never heard before.
No, it's Christmas.
Well, this is not appropriate Christmas music.
No, it's not.
And everybody else is hearing it too. And I have no idea where this is from. No one's entering the Zoom right now.
That is so weird.
It's not participants entering. So it's really weird that this is dinging and they're different sounds.
Oh, there's that one.
So, yeah, it seems to be when they send a message, maybe. It seems to be like every time a message is sent, it's ding, ding. Yeah. Okay. From what I can tell. So
let's try this. Let's...
Okay, so I'm going to try to answer Laura's question.
Yeah, just a little brief, because I think a lot of grandparents are on here. A lot of parents are on here. And I think that they would, to be able to find a tool to provide an alternate to other options that I will say, I think I want to hear from you. How would you articulate the benefit of Eon and X39 in that dilemma?
Well, Eon definitely has a relaxing effect on your muscles, on your nervous system in particular. I believe that's what it's acting on, is your nervous system, targeting that. And the messaging that it's almost like it's saying to yourselves, behave. What's happening to you isn't here right now. Behave right now. Like the bear is not after you right now, right? And so we have to relearn to relax. And it's like, it reminds you to relax, and it has a relaxing effect on the nervous system. It switches over if you've been hyper, vigilant, hyper,
Sorry, guys. I have no idea what happened there.
Oh my goodness.
Okay, hang on. Sorry. I'm trying to figure this out on this end, and We lost your video, Dr. Michelle.
I lost my camera, have I? Oh, here we go. It's all back. It's almost like our system did a control alt delete. That is so
I
funny.
know that's what you're talking about. It's like, where is your video? Oh my gosh, this is crazy. So it doesn't give me an option to even ask you to
It
have your
says
video.
it says you cannot start your video because the host has stopped it.
Oh,
All videos went off. Okay, so hang on. We've got malfunction junction here. Let's see. Start video. Okay, let's try that.
Okay, I see
Start video.
Leah
There we go.
and I
Whew.
see Laura.
Okay.
And now it says start my video.
There
we
you
go.
go. Okay.
there you are.
We're back.
Okay, sorry. Sorry.
Sorry, all the talk about control alt delete. I must have given the message for
I gave this signal. Okay. Go ahead. Sorry. I have no idea where all the sound is coming from in the background. This has never happened in ever any of Zooms.
Ever.
That
3
is
years.
crazy.
I'll try to figure it out. You guys keep talking. I'll mute.
Okay, so
Where do you want me to backtrack to?
so Dr. Michelle, just describe what you feel the benefit in 2 to 3 minutes that X39 and Eon is going to provide people who might experience depression, who might experience anxiety, these symptoms that our bodies are obviously out of balance, right? How is this helping them? I think that's a big question for people.
Well, people who are like chronically anxious, like my daughter's boyfriend, he said as soon as I put it on, he felt relaxed. He felt like his muscles, that all the tension drained out of him. He said it was so immediate, like within an hour, he felt relaxed. So I think it's the cells are signaling to behave. They're signaled to behave, like they're told behave younger, behave, stop with the inflammation. Inflammation will make you feel very anxious. Mm-hmm. So if you are taking away inflammation, which is a physical response, and it can be an emotional response at the same time,
correct,
you're going to feel that right away. You're going to feel like just relax. I noticed too, the first couple of weeks that I was on it, I felt like I was moving differently. And my girlfriend said she watched me walk from behind and she goes, you're moving younger. That's what she said. You're just being younger. But I just feel so relaxed. And I even when I was driving, you get kind of stressed out. I wasn't even stressed out. So it's
amazing.
just very relaxing.
Well, thank you.
And naturally, right? Like you're not hopping yourself up on even herbs can, like kava and other ones can make you feel kind of dampened down. So you don't get that same feeling. You don't feel like you're drugged. You just feel like you're relaxing. That's all I can explain it.
Well, and I think, and I'm going to turn this over to Leah because I know she has a couple questions for you, but I think the thing is that I think everyone is getting out of this is that the technology is designed to bring the body back in balance. Mm-hmm. Right? It's all about balance. It's never about over exceeding or underperforming. It's about the balance, and it's the imbalances that can cause all different types of symptoms. We just happen to be talking about this. So I understand exactly what you're saying, and I appreciate you answering that. Leah, what do you have for the good doctor?
Well, Laura and Dr. Stacy and Dr. Michelle, I want to go back and talk to to our guests that are on, and we've explained how the patch works, but let's talk about some of those frequently asked questions that your clients ask, like how long do I need to wear this, and how long is it going to take for me to feel something? So what do you share with your clients when you get those questions?
Well, a lot of people will say things like, is it going to cure my knee? And then I'll say, eventually, because I said it's not like a magic bullet. You have to build up an army of enough cells for it to be able to go to differentiate and do the repair work that's needed. So I said it's a longer healing time. It's not immediate. It's not like a magic pill. But I do tell them what they can expect within, the first month the first month or the first couple days, you'll start feeling kind of a little bit lighter. Um, within the first 48 hours, there's like 4,000 cells that are behaving younger. As you get into like 3 months, which is when you've really built up your army, then your army of cells for repair, then it can go in and do some of the bigger jobs, and then it might start dealing with your knee if it's already dealt with your heart, but it's going to deal with whatever's the most priority first. So the beauty of it is that your body decides, your inner being decides what's most important, not me, not a doctor, your own, like we're just so wonderfully created. And the fact that we have this red light to heal us, it's mind-blowing to know that we have that. And here we have a technology that just enhances what we already have. And so I just tell them that, within 3 months, you're going to start feeling better. Within 5 months, that's when you need to go get your labs checked again. And you're going to find that they've changed, they've shifted, they're better. So, I don't know what else to say.
Well, no, that's great. And I love that how you talked about it, and what you're saying is that our bodies go through a regenerative process. And it's just that it is a process. It's not a quick fix or an overnight thing, but we've got to give our body that time, because those cells will travel systemically and healing and repairing all the weakest links according to what the body needs the most. Another question that, and it's a real education topic for a lot of people, is the importance of hydration. Can you touch just a little bit on the importance of hydration and how you stress that to your clients when they're using the technology?
Yes, I mean, super important for water anyways in our body, because we are electrical beings, and we all know that even if you've had something electrical go in your house because it's super hot outside, that is very dry and hot. We get that a lot here, where things will go on the blink and you have to like unplug it and plug it back in because there's just not enough humidity in the air. It's super dry in Canada in the winter in particular. So if internally you're super dry, you're just not going to be having the electrical charges or flow of blood or flow of detoxification. It's very important for every aspect of your body. I think when we were in school, they said you need about a cup of water for every hour or so. So every waking hour, about a cup of water, which seems like a lot of water, but you need that much for all your organs just to be able to detox and move. And of course the cells are made of water. So, and we're made of water. We're 90% water. So they need to be hydrated to really get the full benefit of it. That's what I say.
I love that. We've always say and teach rule of thumb is half of your body weight in ounces daily, which, depending on, your 8-hour, 10-hour day, that could be just about that same amount. One of the things that I actually was, when I was with Dr. Stacy, when we first joined, we went out to Long Beach, California, and I remember David showing us images of dehydrated cells versus hydrated cells under a microscope. And that was really eye-opening because, like you said, our cells are water and they need the conductivity to communicate with each other. So are there any other frequently asked questions that you get? I know I get a lot of different ones. How long do we need to do this? Like, do I need to patch for the rest of my life? What is your answer to that question?
I tell them a rule of thumb, and there is a rule of thumb for almost every modality to do things. But the rule of thumb is 1 month for every decade of age you are. So I'm 62. So, I needed to give it a good try for at least 6 to 7 months. But I just kept continuing because I just really am enjoying the texture of my skin. I mean, I'm having even dark little tiny moles disappear and things like that. So I just keep going because I just feel good on it. So But for instance, like herbal medicine, they say 1 month for every year you are. So herbal medicine, if you had something until you were age 33, you'd have to take it for 33 months. So this one does some very deep work. I would say it's getting to the root of the work. And we didn't have a chance to talk about one of my patches that I really think is quite important, which is the Alavida from a naturopath standpoint. Because from a naturopath standpoint, we say digestion, absorption, or realtors say location. But I find that a lot of people have issues with their gut and with their gut lining. And the Alavida is very good for all linings in your skin and your hair and your nails, but also all the linings in your body to repair any damage. And you can get damage from taking antibiotics, you can get damage from having food allergies, from pesticides, from herbicides, from all kinds of things can damage our linings. So that I really like Alavida patch. I know everybody likes the dynamic duo. I like the three of them. I like X39, Aeon, and Alavida. And I like Alavida too because it lengthens the telomeres. And that is not an easy thing to do if you were to try to do it. And I think I said a little bit in my bio. If you were trying to lengthen your telomeres, you would have to do extreme fasting, cold plunges, and hit like extreme exercise. And you can do that, but it's really hard to sustain. Whereas the patch is just very simple. It's a simple, elegant modality for busy people.
Wow, I've never heard it described that way. The perfect, elegant modality, Alavida. That's interesting that you should say that.
Mm-hmm.
That's really interesting.
Well, all of the whole technology, it's elegant, really elegant and non-invasive and very powerful. Like I say, to be able to go and have your cells renewed and to have like patterns repaired that have been going on for a long time and then no longer having those issues is incredible. It's incredible. And I don't know, like I said, herbs take so long and they're wonderful. And I had issues with my lungs as a child. I had pneumonia 26 times. So I had 26 scars on my lungs when we moved to Australia. They said, you have a lot of scarring. And I said, I know. So my teacher gave me a remedy to use and I used it for 33 months. I was 33 years old. We were moving to another country and they x-rayed my lungs. I said, oh, I got 26 scars on my lungs. And they went, no, you don't. What? So, these things work, but you do have to be consistent. You have to, you can't just put it on one day and then not put it on another day. You do really need to be consistent and do the long haul in the very beginning. In particular, I could say the first 6 or 7 months, you have to be very vigilant about putting it on the patch, taking it off. And it is important to take it off. Sometimes we forget and you leave it on all night or whatever, but it's just as important to have it off as it is on.
Right. We
So
don't
we have
want
a
our body
question
to
in-
get,
Go
I was
ahead.
gonna say, we don't want our body to get used to that signal. So we say wear it for 12 hours. We're going to activate and elevate. Take it off for 12 hours. Now repair and regeneration starts.
Yeah.
That process. Dr. Stacy, I want to toss it back over to you. I think there may be some questions we want to answer in the chat.
Yeah.
Absolutely. And I appreciate all of you that are sending me the private messages. I'm on the back end looking at the Zoom going, why all of a sudden did this randomly start to where we're hearing these noises when people exit, right? And my switch is toggled off. I have no idea. I've never had that happen again. So there must be a little glitch in the Zoom or something because I swear I could screen share with you right now. It's toggled off. You guys know we've never heard this before. So Who knows? I'll update Zoom and maybe it'll fix itself later. So before we finish up though this evening, Dr. Michelle, we do have some questions in the chat for some people.
Sure.
They're really interested in hearing a little bit more about different things. Okay. So, of course, we've talked about a lot of topics tonight and a lot of different things that, again, we're not talking about any specific diseases or anything like that. But they're wanting you to elaborate a little bit more on Alavida, as far as talking about like placement, where do you put it? How long do you leave it on? Because it is a nighttime patch. Can you go a little bit more in depth with the Alavida for them? Because there are quite a few questions in the chat.
Absolutely. Yeah, I do. I wear Alavida at night. So does my husband. And I get my husband to put his placements near where they had dug out some of his skin.
Mm-hmm.
I get him so you can do that in acupuncture. That's called circle the dragon. You go near where the site of the injury is. I usually put it right in the middle of my forehead, or I'll put it on my 3 tunes down from my hairline. I'll put it on the back there too. But generally speaking, I like to put it on my forehead. And like I said, I love this particular patch because it really does go and heal linings, and in particular, like I'm leaky gut is huge for so many people. If you've ever been on any antibiotic, or if you've ever gotten sick, really sick when you've gone somewhere, if you have, allergies, inflammation will make holes. But also it's very good for the inner parts of your cardiovascular system, for any skin, any lining. And if you have skin issues, or some people have said I've had skin issues all my life. In fact, my lady that does my facials, she had for 25 years, she had a patch of eczema right here. And in 1 month it was gone. And she said that's the first time in 25 years that it's been gone. So if you suffer with some skin issues, definitely you want to incorporate Alavida into your regime.
Mm-hmm. So skin issues, and then you mentioned gut issues as well too. And I know we've heard Dr. Harmon talk about the benefits before with the Alavida and the gut because, of course, the epithelium lining. So do you work with many people, or have you seen over the scope of your practice that people have a lot of gut issues?
Yeah, I mean, I also I use iridology when I look at people's eyes. I can tell if they're having issues around their gut. I can tell if they have a leaky gut. But you'll also have cognitive issues, emotional issues. Like it's very connected. And they're starting to know this now. And they know that the biome is very connected to how you feel, what you're thinking, all that kind of stuff. So the Alavida is just truly, just to me, I'm so impressed with it. It's one of my favorite patches. I mean, X39 is the best patch. Yeah. If you could only have one patch and you're on a deserted island, X39 would be the one I'd want. But if I could have three, it'd be X39, Aeon, and Alavida. That's what I would do.
Wow.
And that's what I usually give people, and they understand and they like it. Then you're kind of getting a therapeutic dose all day long of something, even though they're different peptides and different things that it's working with. Yeah, I don't think we really talked about that too much, that there's different peptides involved in different patches.
Yeah, and I agree with you because, X39 is our flagship. End all be all. Everyone should use the X39 for what it does, all the things that it will do, that cascade effect in the body, right? That compound effect over time. I love Aeon. Aeon is going to reduce that inflammation. It's going to bring that nervous system into balance. It elevates a peptide in the liver. But Alavida, like you said, is very different, activating and elevating a different peptide in our pineal gland. And when you look at, I always talk about an apple tree or cherry or, orange, pear tree, whatever, tree out back, okay? Wherever you live, and you'd go out there, you'd pick the apple and you'd eat it. That would be perfectly fine. You'd walk out to the tree and, oh my gosh, an apple fell in front of me, just hit the ground, I'm going to pick it up and I'm going to eat it. But if you walked out there and that apple had been there for 7 days, you are not going to pick it up and eat it. And so that apple that's been on the ground for 7 days is oxidizing, right? We call that oxidative stress. And
Mhm.
you guys don't realize this, but that's what your cells look like on the inside.
Mm.
Look like that from the toxins that we're bombarded with. The fried, processed, packaged foods. They look like that from the personal care and cleaning products that we are using that's going into our skin, right? Everything you wash your hands with, you wash your body, wash your hair, every cleaning supply that you use is going through your skin and into your body and creating that oxidative stress. And of course, stress, mental, emotional stress, right? You talked about psychotherapy. This stress that we're under here, a lot of it's self-inflicted, right? Or we just don't manage it correctly. But that stress causes that oxidative stress in our cells. And so Alavida says, let me target this in a whole different way from X39 and from Eon. And it's really, we call it the sleeper patch. And it is a nighttime patch. It does elevate melatonin a little. It does help improve your cognition. You said you've seen a lot of cognitive benefits from the people that you know that are patching. And we know Alavida has a lot of cognitive benefits with it. And so being able to help those things, but also a big component of Alavida is the organ benefits. When we look at your male and female reproductive organs. So if you kind of would think, what does a female normally deal with around your age, right? My age, the 50s, the 60s. What does a male deal with around the exact same time in
Mhm.
their reproductive organs? And so Alavida really gets in there and says, let's make sure all of this is functioning correctly as well. It's powerful. It's a powerful trio for sure.
Well, and the fact that it lengthens the telomeres. I mean, you can't do much about the ones that are lost their telomeres and they're making their way out of your body, and it can cause some inflammation too. So it's another way to reduce some of the inflammation. But there aren't many things, like I said, that can lengthen those telomeres, and you want to keep them nice and long. That is like such an anti-aging and age reversing thing is to do that. And that starts happening right in our 20s. We start getting telomere shortenings.
Mm.
Whereas by the time we're about 35, I think we've lost about half of our cell activity.
Mm-hmm.
And then by the time you're my age, it's probably more like 90%. So yeah, I mean, young people go, this isn't for me. Oh, Alavida is. Alavida's for everybody for sure. So yeah, that's the one thing. And like I say, I want to call him my son-in-law because I think they're going to get married, but he's really noticing big differences, and I suspect he had some pretty serious gut lining issues, and the Alavida is really helping him. And emotionally, in particular, he's shocked at how much emotionally that's helping him, because he used to have to do like depression drugs and stuff, and he got rid of all of them. He decided he didn't want to do them anymore. So I said, okay, talk to your doctor, but but if you feel you don't need them, just talk to him first. So, anyway.
I love that. That's amazing. We've just got a couple minutes left. Laura, do you have any last minute questions for Dr. Michelle?
I really don't. Well, you know what? People have asked in the chat, Dr. Stacy, about carnosine.
Mm-hmm.
Dr. Michelle, what is your opinion and use, be it yourself, be it your family, clients, with the carnosine patch? And what have you noticed or seen?
Well, we just got the carnosine patch in Canada. So, and I haven't used it very much. I did order it in this last one, but I used the glutathione patch
Mm-hmm.
only because someone got it to me. That was the only way I could get it, but now we can get it. But I mean, obviously, carnosine it's an amino acid. So, and with antioxidant properties, and anything you can do to boost your antioxidants is fantastic. Our body.
Awesome.
Our body needs them. They decline. Lots of things bump them out. Free radicals keep them busy. So yeah.
Good.
You know,
Thank you.
it scavenges
Yeah.
free radicals. So anything you can do to do that is going to be fantastic.
Perfect. Thank you so much.
Well, thank you, Leah and Laura, for joining me on here tonight. I knew you guys had some questions as well, too, to ask Dr. Michelle. Thank you, Dr. Michelle, for taking the time out this evening to join us. I apologize for the dings. We got those taken care of now. Woo! You know, just a little Christmas background sounds or something or another along those lines. But
What was the dings? Did you figure it out?
it was
Or
when
just-
people were leaving, so people were coming in, but every time people left, then it would ding. There was a notification that was ticked that was not supposed to be. It's totally fine. We got that figured out now, but it's all good.
All
But
right.
thank you, Dr. Michelle, for taking the time to be here to share with us your expertise and your background and your knowledge and the information that you have gained from using LifeWave's technology.
Thank you very much.
You're welcome.
Thank you.
You're welcome.
Thanks
Thank
for
you,
having me.
everyone. Have a fantastic evening. And like I said, this is our December 17th Zoom. And of course, next week is Christmas Eve, and the following week is New Year's Eve. So we wish everyone to have a fantastic holiday. Enjoy your time with your family, your friends, your loved ones. And we look forward to kicking off the new year with all of you. Thank you again, for everyone, for being here. And thank you again, Dr. Michelle. Thank you, Laura.
Thank
you,
you.
Leah.